So welcome to this webinar. Today we will be discussing about choice and control of persons with disabilities during COVID-19. My name is Konstantina Leventi and I will be moderating the panel discussions. I work as a policy and project officer at EASPD. I have blonde hair, I'm wearing glasses and a yellow sweater, and on my background I have included EASPD's logo. Before starting, I will also provide you with some technical information. First of all, I would like to inform you that this webinar is recorded and will be available afterwards on EASPD's social media channels. You are muted and we cannot see you in order to ensure the quality of the session. However, in order to keep as interactive as possible this webinar, I will invite you to post your questions either in the chat box or by using the Q&A button in the bottom of your screen. Additionally, we have closed captioning. That means speech to text, and you can activate it by clicking on the closed caption button on the bottom of your screen as well. Now, I would like to pass the floor to Luc Zeldero, Secretary General at EASPD, for the welcoming remarks. Luc, the floor is yours.
Thank you very much, Konstantina, and thank you already now for organizing this webinar. Dear participants, as said by Konstantina, I'm Luc Zeldero, Secretary General of EASPD. I wear glasses and my hair is a bit grayish, and that comes, I think, due to the fact that I'm not new in this field. Dear participants, welcome at this webinar. The fact that you are so many is a clear proof of the importance of this debate. We all know that choice and self-determination are key elements for our well-being. Living with the people you want to live with, controlling your life, choosing your job, deciding on the use of your money, it's all so essential. Still, it is far from being the reality for all persons with a disability, especially persons with intellectual disabilities or people living with mental health issues or struggling with psychosocial challenges are amongst those most deprived from enjoying this simple but basic rights. And COVID-19 made it even clearer. Often choice and control were washed away by imposed safety measures. Although Article 12 of the UN Convention on the Rights of Persons with Disability reconfirmed that all persons with disability should have full legal capacity, it is not yet the reality. It is not yet the reality for many that they indeed have equal access to justice or can enjoy all their legal rights. It is still problematic in most European countries. As far as we know, not one country in Europe has legal juridical frameworks that are fully in line with the ambition of Article 12 of the Convention. Substituted decision-making is still pretty much the norm. Supported decision-making very marginal. The focus should be on creating the right conditions and support so that individuals can enjoy their rights. Not stripping away legal capacity for the sake of safety and protection should be at the top of our mind all the time. Indeed, only when people enjoy their legal rights and have full legal capacity, we will be able to build a more inclusive society, a more inclusive labor market, create conditions for independent living. Dear colleagues, most of you are service providers, are working in the support providing systems that we have. For us, this debate is also crucial. Often it is the provider or the professional that is sandwiched between the wish and the choice of the service user and disempowering legislation. Often it is the professional, it is the support worker that is sandwiched between the wish of people to control their life and to decide. And at the other side, we see then patronizing guardian systems and intimidating juridical procedures. This position for the professionals is a very difficult position. And that is one of the reasons why we thought that it is important to organize this debate. On top of that, and that is another reason why this debate is so timely and so important, at this very moment, the Council of Europe is debating an additional protocol to the Oviedo Convention. And this protocol, in a way, would legalize involuntary placement and forced treatment. The protocol starts from the old medical defect model instead of embracing the empowering human rights approach of the convention. We, as ESPD, we joined the coalition of networks of organizations of persons with a disability and self-advocates opposing the draft protocol. This coalition is led by EDF, and I would like to express my gratitude to Pat Clark, who is with us today and represents EDF, and who will, without any doubt, give more information on what EDF has in mind to indeed organize the disability movement to stop the further development of this draft protocol. Dear participants, this afternoon we'll debate the state of play in Europe with regard to legal capacity for individuals with support needs, persons with disabilities. We will debate, we will discuss the role of support services, facilitating choice and control. We will look at the challenges that service providers will have to face, because indeed it is not always easy. And sometimes we indeed are in a sort of a sandwiched situation. And we will look at the next steps. We will look at the way forward. We have lined up for you a set of top class speakers, and they will introduce the different topics and issues. I wish you a very enriching afternoon. And I now would like to hand back to Konstantina, who is our moderator for this important event. I wish you a very interesting afternoon. Thank you.
Thank you, Luke, very much for your welcoming remarks. You set the scene of this webinar very well, and you were also you also highlighted the difficult times that we are facing, and most importantly, persons with disabilities are facing with the draft additional protocol. So this webinar, as Luke already mentioned, is divided into two separate panels, and it will run until 3:30 p.m. Central European Time. So without further ado, I would like to invite our first speaker, Teresa Guimares from Humanitas in Portugal. And Teresa, please give us an overview of what is the state of play on legal capacity in Portugal.
Thank you, Constantina. Good afternoon, everyone. I'm in Portugal, Porto, the town of port wine. I wish you know that wine. I have brown hair. I'm using glasses since I am 50 now. I need these glasses to can read. So behind me, you have the logo of Humanitas, the federation I represent today. I will share my screen now and hope you can see it already. So Humanitas is a Portuguese federation of non-profit organizations working for the habilitation and rehabilitation of persons with intellectual disabilities. It represents now about 40 social providers for almost 6,000 persons with intellectual disabilities. I won't read our objectives now. You can see it later since our presentation will be shared with you. And I will now talk about legal capacity in Portugal. Between 1966 and 2018, Portuguese legislation, the old legislation, represented the civil death of the person under guardianship. Persons with intellectual disabilities were substituted in decision-making with a rigid and paternalist guardianship. They were not able to decide, to make choices or participate in political decision-making, and persons with intellectual disabilities were more vulnerable to abuses and negligence. With the UN CRPD's implementation in Portugal, it marks a new paradigm in which persons with disabilities were no longer objects of care and protection and started to be subjects with rights, able to make decisions on their lives with the adequate support to enable full citizenship. Since 2018, we have a new law, the 49 law. This legislation on legal capacity is a framework that seeks to transpose the national context of the standards of the UN CRPD regarding legal capacity and equality before the law, like Article 12 of the Convention. Under the new law, it is up to the court to define the level of support that each person receives and the range of support measures to be deployed. By this law, the judge must hear the person before deciding the support measures. Each person has a prosecutor to assure his rights are defended. The person can choose his guardian. Measures are reviewed each 5 years. And the support person can maintain some activities in life without guardianship, without support measures like marriage, sign a contract, vote, etc. Everything of these measures are new. However, this is not perfect yet. Courts tend to follow old habits and continue to impose measures of maximum support, which restrict the legal capacity of persons with intellectual disabilities. There is a lack of training regarding judges, prosecutors, families, and guardians, and other people involved in the process. Decision of the judge is still supported in medical reports. We think it is important to involve therapists and social technicians in the process because they are in social providers, and social providers are committed in training persons with intellectual disabilities to be self-determinated, to be able to make own choices, and learning rights and obligations and increase social participation. So that's all for now for me. Thank you.
Thank you very much, Teresa, for your intervention and for the comprehensive overview of the state of play of legal capacity in Portugal. Something that I would like to highlight from your presentation is how important it is to provide adequate training to professionals and raising awareness among legal practitioners on the right of persons with disabilities to legal capacity and access to justice. So thank you again for your intervention. And now I would like to pass the floor to Simon from the Centre for Welfare Reform in the UK. And Simon, can you also please give us a state of play on legal capacity in the UK?
Thanks, Constantina. Yes, I'm Simon Duffy, and I'm sitting in my living room with some pictures of the Peak District, which is hills near Sheffield, where I live, in the north of England. And I've got a blue shirt and glasses. I am 56, so I'm a little bit older than Teresa. The state of play in the UK, well, always bear in mind that the UK is really 4 countries. So the legal situation and the policy situation is different. But some of the general points I'm going to make are probably fairly consistent across the 4 countries of the United Kingdom. the United Kingdom legally is kind of in an interesting position in respect to mental capacity, because quite a fundamental principle of our law is that everybody is deemed to have capacity. And it takes a significant legal intervention to take capacity away. So I think what makes our law, and I think this is generally a positive thing, although there are some problems that go with it, but what makes our law a little bit unusual compared to some countries is there is no general presumption that somebody who is in some way categorized as having an intellectual disability, mental impairment, mental health problem, or any such issue has lost any legal power. Does that make sense? You're assumed to have all the ordinary legal powers of every other citizen, unless somebody specifically goes to court to seek some kind of special measure. And the law is, again, it varies between the countries, but the reasons that people go to the courts are usually either because of severe mental breakdown, so more to do with mental illness, or a situation where somebody wants to assert some form of substitute decision making. And this does happen with some people with intellectual disabilities and some older people, but it is really quite rare. So in all my practical work with people with intellectual disabilities, I cannot remember one instance of people going to the courts to assert some kind of substitute decision-making arrangement. It's a very unusual thing in our system. So when it comes to comparing the legal system to the UN Convention, then there are strengths and weaknesses. The strength is the assumption of capacity. The weakness is that the system, our systems often don't fully respect people's authority and their right to freedom, but more through de facto actions, yes, by the practical things that go on. It's more the assumptions that people make. It's not really the law that is the problem. So again, I think it is very important in any of our considerations to remember that law doesn't really change behavior. It does provide a framework and incentives and controls, but it doesn't really change behavior, because in the UK, it's quite normal for social work, social services, families to slip into assuming that somebody doesn't have capacity, just assuming they don't have capacity and behaving as if they don't have capacity, even though the law would say this person does have capacity. So we've, in practice, different communities have had to work hard at finding practical solutions to encourage people to take up their rights. Self-advocacy is the most important aspect of this. So in the UK, we do have good self-advocacy groups, people with intellectual disabilities coming together, speaking up for themselves, supporting others. That's a very important dimension. And over the last 20 years, we've certainly seen improved self-advocacy. We've seen legal systems of advocacy introduced by the state, but often those systems are very weak. So funding for voluntary organizations to provide legal help around advocacy is often rather compromised, because the funder is often the same body that is the one that is in control of funding services, cutting services, restricting eligibility. So our whole structure of advocacy, I would say, is one of our problems in the UK. It's very messy, it's rather bureaucratic, and it doesn't really support people's capacity to be free citizens. And generally, the UK has been a little bit, the UK has a habit of signing things, like it signed the Convention of Rights for Persons with Disabilities very early, but then doesn't think about what that means. So there's a big gap between the symbolic act and the real practice on the ground. Does that help?
Very much, and thank you very much also for the very comprehensive overview that you provided with us. And something that you already highlighted is that even when we have, if I might say, a more well-developed system, that doesn't mean that there are not still challenges. And what happens in reality may be completely different from what, for example, might be intended by the law. So that also further indicates that, of course, we need clear legal frameworks in place. This is something that is essential, but this is also only one side of the coin. So thank you very much, Simon, for your contribution. And I would like now to pass the floor back to Teresa. And Teresa, I would like to ask you, as a federation with members all over Portugal, how has COVID-19 impacted choice and control of persons with disabilities? And also, what were the challenges that service providers faced in this regard?
Mm-hmm. Thank you, Constantina. I will share my screen again to answer that question. So since middle March, persons in social care homes were not allowed to go out from their homes. They can't visit families, they can work, go to training or daily activity centers or occupational centers, sports, social life, etc. They are still at social care homes. In spite of they are all vaccinated now, they are not allowed to go out yet. And some persons stay at home with parents without going out also. Parents were very scared of this disease and hospitalization also. And this increased a new problem, a new issue, loneliness and anxiety of the persons. Social providers, when the Vaccination Act began, must have an authorization for the vaccination. But in many cases, we felt that this decision was taken by families and guardians without a conversation or an explanation with the person. The anxiety was so high that there is no time to talk to the person and to decide together what to do. Many persons with intellectual disabilities also lost their jobs in social enterprise and other organizations, so they lost also his or her financial capacity. And this last week, these difficulties in digital communication create a new barrier in participation and in citizenship of these persons. This is the main issues we felt in this last year. I would like to share with you our Portuguese António Guterres, the UN Secretary General of when he talked in 6th of May. He said we must guarantee the equal rights of people with disabilities to access healthcare and life-saving procedures during the pandemic. And we feel this is not guaranteed in Portugal. And with this, I end my. I hope I was clear. Thank you.
Thank you, Teresa. Very clear messages, and it showcases how persons with disabilities, unfortunately, were even further excluded from the community during the COVID-19 pandemic. And also we, at the SPD, we had a while back a webinar on on vaccinations, and something that it was very clear, it was that many people were not, did not have a say whether they were not going to proceed with the vaccination or not, but most importantly, they didn't have access to information regarding the vaccines in order to be able to give their informed consent. So thank you for highlighting this in your presentation as well. Simon, can I ask the same question to you to provide us with your perspective from your network on how COVID-19 has further exacerbated the situation? Thank you.
I suppose the most striking thing about the COVID crisis, putting aside the restrictions which have obviously affected all people in the population, but very early on in 2020, the government and public officials started talking about shielding and protecting vulnerable people. And a lot of us don't really like this phrase, vulnerable people. But they then started talking about protecting people in care homes because they could see the high death rates in Spain and Italy. This sounded good, except for the extreme problem, which was that the hospital system then pushed patients, many of whom with infections of COVID-19, into care homes. So we have seen now 35,000 people die in care homes. A lot of those people are older people, but a lot of those people are also people with intellectual disabilities. So residential care has been really, and I don't like using such an extreme word, but it has become a kind of death zone for many, many people. And it has raised huge questions about what was the government doing, but also why do we still have such a very high use of residential care, which the UK does have very high levels of residential care. Because although we closed long stay institutions largely by the end of the 1990s, we replaced those with very large, and we have privatized a lot of that residential care. So a lot of the worst residential care is very large residential care units controlled by US companies. And it's these residential care services where the highest death rates are. So I think, to put it very crudely, the biggest problem about COVID-19 has been the deaths that it has caused rather than the restrictions. And those deaths are not distributed equally. Those deaths are targeted, and disabled people are particularly targeted. And I don't want to suggest that there was a malign intention by our government, but it's either bad intentions or extreme stupidity. This is a common feature of our government, so I'm not asking for too much sympathy. But this problem was also seen again. So another major thing that we saw was we use this phrase DNR, do not resuscitate orders. So in the medical system, doctors can sometimes add a note to people's medical records to say this person, if they go into heart failure or if there's a severe medical problem, you do not need to resuscitate them. We saw the health bureaucracy, although it's very unclear who was driving this, send notes that were put into people's medical records without their permission, without the permission of their family. And this was done for many older people, but also many people with intellectual disabilities, who on no basis other than they had an intellectual disability, and certainly not with any permission. So this is a kind of frightening little eugenic measure that seemed to be a feature of our government's response. With vaccinations, we've seen, interestingly, the same problem. People with intellectual disabilities were left very low on the list. actually that has been reversed by public pressure. So where people have been able to organise and push back against the government, then we have seen changes in policy. But some of these things that happen very quickly and with no scrutiny certainly were either very incompetent or worse, intentionally eugenic. The other thing that's interesting, I suppose, and this is maybe a more positive thing, as well as high levels of residential care, the UK has high levels of people who use self-directed support, direct payments or other ways of just personalising their support. And actually those people have done okay because they've been able to find creative ways of responding to the crisis. They're not stuck within any institutional arrangements. So we've seen a big divide really between institutional arrangements where there've been severe problems, and then more personalized arrangements where, of course, people share some of the same restrictions, but people have also been able to be creative. Families, communities, supporters have come up with different solutions that work for them, reduce the risk of infection, and also help people have interesting lives. And the final thing, what we've certainly seen a lot of people with intellectual disabilities make very positive use of Zoom and FaceTime and all this technology. So we've seen some very interesting positive things that people have been able to do just as well, or sometimes even better than professionals.
Thank you, Simon, very much for your intervention, and thank you for putting a positive spin at the end. However, what you mentioned in the beginning is really frightening, and it's something that we need to keep our eyes open, and we need to ensure that situations as such will not happen again in the future. Now that you mentioned self-directed support, I would just like to quickly mention and inform our participants that together with Simon, we collaborate in a project which is called Unique, and this project aims in developing a toolbox that will support service providers, service users, but also, and most importantly, public authorities on how to use and implement a user-centered funding model such as personal budgets. So we hope that with the outcomes of this project, we will also bring we will also facilitate choice and control of persons with disabilities more in terms of being able to decide for their own support and health systems. So thank you both, Teresa and Simon, for your contributions. Is there anything else that you would like to mention before I pass the floor to the next speaker? Thank you again. So now we saw, as I mentioned previously, we saw one part of one side of the coin, and that is legal frameworks, which are essential, and we need clear legal frameworks to be in place. However, when we are talking about enjoyment of legal capacity, we also mean a shift from substitute decision making, and where the legal guardians are the ones that are making decisions for the individuals, to one that is based on the supported decision making. Supported decision making includes different forms of support, which further facilitate the legal capacity of persons with disabilities based on their will and preference, and not on what is perceived as being in their objective best interest. So now during these panels, we are going to further discuss about supported decision-making in practice and hear perspectives from service providers, persons with disabilities, and families. We have also seen that service providers, even when the legal frameworks are not yet at adapted to promote legal capacity, they are trying to introduce the changes following a bottom-up approach. So I will now like to invite Sofia Karagouni from Margarita in Greece to showcase how they have adapted their services and have introduced supported decision-making. Sofia, the floor is yours.
Thank you, Konstantina. Hello to everyone. It is nice to hear similar stories like the situation that happens in Greece and also see perhaps the next level in legal framework evolving. So, as we said, my name is Sofia and I'm a project manager from the RDI Department of Vocational Training Center Margarita. Margarita is a Greek organization that offers vocational and educational training services to people with intellectual disabilities, aiming to increase their autonomy and independency. And the road to autonomy is very strongly connected with decision-making and the right to make choices for your own life. And despite the barriers we may face due to the lack of legal framework relevant to support decision-making in Greece, especially for people with intellectual disabilities, Margarita is diligently working to develop a support decision-making service. The Convention on the Rights of People with Disabilities was ratified in Greece in 2012. And it was a hopeful sign that we will respect the rights of people with disabilities. Despite this commitment that we have made as a country, the shift from the present substitute decision-making paradigm towards support decision-making model has not been made as of yet, due to, as it appears, the reason was a bit...
excuse me, can you please speak a little bit slower just for the captioner?
Okay,
thank you so much.
Okay. The shift has not been made as of yet because more time and initiatives are required from the relevant stakeholders, which are, public bodies, service providers, the families, and of course, people with disabilities. Margarita's initiative started in 2017 with an Erasmus project called I Decide, which gave us a chance to train our professionals and develop tools regarding support decision-making in 3 major fields of life, which are finance, health, and consumer rights. Additionally, we hosted a 2-day visit from 3 ESPD Lighthouse experts from Support Girona and Som Fundación, who came to Greece and shared with us their good experiences and practices. In both cases, the contribution of our service users and the families was very important because it helped us understand better how to support them from our side in changing and adopting support decision-making in their daily lives. In general, the conclusions that we reached from these actions was that support decision-making is quite a new concept for our service users and the families, but no matter what, they are quite eager to learn and find ways to make changes in order to create more opportunities for support decision-making in their lives. For this reason, Margarita is focusing on raising awareness, training, and implementing services that follow the social model of disability. And it is highly important for the parties that are involved in support decision-making services to understand firstly the meaning and the different forms of restrictions of legal capacity that takes depending on the national legislation in its country, the contents of Article 12 of UNCRPD, and of course what support decision-making means when it is applied in their daily lives. Our social and psychology department, together with our trainers, support the families and our service users in understanding these issues. And through our support, we collaborate with people with intellectual disabilities to become better aware of their rights and develop their own personal decision plans. And at the same time, we collaborate with families in order to help them contribute more effectively in the development of decision-making opportunities based on the will and preferences of their family member with disability. And it is very important at this point, the role of the professional, especially when we are living a transitional phase between the two different approaches in legal capacity and decision-making. The professional can help the families understand that even if their family member with disability may be under guardianship with limited legal capacity, that does not mean that they cannot provide situations and freedom of will for that person to make their own choices. And in Margarita's case, and especially since the Greek framework is heavily leading towards guardianship, we are talking about low-level decision-making. And because this way, through activities that are about low-level decision-making, we will support the families and people with intellectual disabilities feel more comfortable with this new practice and make small changes that we hope soon will become bigger, practice this in a safe way. The supporter, when implementing this service, collaborates with the service user and the family in order to identify and measure the needs of the service users. This collaboration leads to the development of custom-made tools and methodologies that will increase the independence and provide more control and responsibilities to the person with disability in their own life. At the same time, the professional, together with the person with disability and their family, will also develop a risk management plan and place proper safeguards in order to avoid any bad scenarios or scenarios of abuse. And of course, the professional is also there to always provide answers and respond to hesitations the family and the person with disability may have. It goes without saying, of course, that in order to increase the impact of such actions and provide all the tools and the safeguards for the exercise of legal capacity to the fullest, the Greek legal framework on equal recognition before law must be reformed accordingly. But that does not mean that service providers, families, and people with disabilities cannot take the initiative. We can take the initiative, we can make small steps and improve and introduce in our lives and organizations support decision-making. And the first step, I know it's very simple when I will say that when the legal capacity and decision-making is quite complicated, but the first step is to truly listen and find solutions and discuss instead of finding excuses from the barriers to do nothing. Thank you.
Thank you, Sophia. Very important messages. Thank you very much for your intervention. You highlighted so many different things. I will just briefly mention the role of professionals and how important is the role of professionals to support the person and the family to start changing the mindset, because also it was mentioned in the beginning, if I'm not mistaken, by Simon, that it's not only about legal frameworks, it's also about a change in the mindset. So it is really important, and thank you for your contribution. And now, if I may pass the floor to Kirsi Konola from Service Foundation for People with an Intellectual Disability in Finland. So Kirsi, after demonstrating how supported decision-making is practically feasible, can you please let us know what are the challenges faced by service providers, and how can maybe service providers step up their efforts in order to facilitate choice and control of persons with disabilities? Kirsi, the floor is yours.
Thank you, Konstantina. Good afternoon, everybody. It's a pleasure to be with you and to share some ideas with you. It has been really interesting so far also, and maybe I give some comments to the previous speakers also. Indeed, I try to reflect the choice and control from the perspective of service provider and in the times of during the COVID-19. You can put this next slide, please. What does it mean, supported decision-making in practice at this a very challenging time, of course. And of course, we can say, like has been, I think, highlighted for many of you, that it has been challenged seriously during the COVID-19. Of course, this goes for all citizens, but has been more extreme with vulnerable people, even if, of course, like Simon said, the term is maybe not correct. I think the picture ESPD had in the advertisement of this event was very correct with the wage of two wages, because we can all understand that health and safety has been, let's say, prioritized as human right, but at the same time there is many other human rights which has been restricted, and of course this has been very serious for people, for example, living in group homes and so on. Even if, of course, we all understand that in that kind of circumstances, it's really important also that the disease is not getting in there. But I think the wage picture is extremely good in this context. So of course, this has been very demanding for service providers. How staff can maintain and support choice and decision making when this has been restricted in very serious way. I can say I didn't say anything about my background. I'm a CEO of Service Foundation for people with intellectual disability, like Konstantina said. We are supporting in their everyday lives around 1,500 people with intellectual disability, mostly with very high support needs all over Finland. So this has demanded really a lot from the staff, thinking how they can maintain and support so that people still have possibility to make choices and support the decision making in this time. And one very important fact has been that the easy to read information about the pandemic is really important, because this helps staff to explain for people with disability, for example, safety measures, hygiene, what does it mean, what this situation means, and everything like this. And this supports the participation in this state of emergency, let's say, so that people can still go participate in their community, be part of it, make choices and have control even at this time. And so it's important that they know about how they can protect themselves and others. So this easy to read information is very important. I think quite simple topic, but I think quite important to say. Next slide, please. I think this has been little bit said something from the previous speakers about this, but authorities have not been able to identify special features of social services. Like Simon said, that the hospitalized like habits and implementations have taken over all of the places mostly. And this has, for example, led to categoric quarantine decisions and this kind of thing. So it has been really a challenge during this year that authorities have not realized, for example, the difference between social service and the healthcare unit, let's say, and this has created really serious challenges for choice and control, let's say. This has improved a bit in my country, in Finland, since the decision-making power has been shifted from national level to local level. So this difference between health and social service has been recognized in better way at local level. But however, I think this creates, and hopefully when let's say this crisis is over, this will be discussed in serious way again, that it is indeed different to provide social services than healthcare services. This is one challenge, definitely. We can go to the next slide, please. However, service providers have been able to support choice and control during COVID-19. The staff has, of course, first last springtime, it was a big shock when all of it happens. And also, I think, for example, in our country, the restrictions were very extreme back then. And one challenge was, for example, that people with the disabilities were treated in the same way as people with the elderly people, for example, who of course have different kind of health issues and so on. And in the first place, all the restrictions and so on were applied, let's say, all the people who need services, and this was very difficult. And also the staff was almost in the shock, and everything was very new. But now, after we have lived in this situation already a long time, the staff is able to support people's normal life as normal as possible, and to make choices in that context. The staff has learned how to do that, and I believe that many of our service users, for example, live a quite normal life, as normal as it's possible in current situations. Activities, for example, happen in very small groups everywhere, just one staff member and one person with disability. And also participation in the community happens in very individual places, individual ways. And this has led to good examples, of course, good practices. One challenge has been that people's right to participate in daytime activities has been restricted. And this has required, of course, a lot of flexibility, and service providers have to operate in very proactive way so that people have meaningful activities based on their own choices. Also, when they can't participate in their normal daytime activities, or even to their jobs, this has also been restricted because the job coaching and things like that have been restricted in some cases. So, of course, this has demanding a lot of flexibility so that people can still exercise the activities they want. We can go to the next slide. A few words still about how staff has been, service provider have been able to support the choice and control. One topic which can be also useful and important for the future is that the service providers have supported contacts between people with disabilities and their families by offering different kind of digital tools. This has improved, of course, people's opportunities to have control over their social relationships, and increased ability to use digital tools will support choice and support these social relationships also in the future. This is very important, I think, and also in the society. Of course, all the societies have taken very big digital step forward, so it's important that people with disabilities also can be part of that and can exercise their decision making, for example, in these new kind of environments, digital environments also. During the COVID-19, staff has paid extra attention to psychosocial support. People have a lot of fears and things like this. And this has kind of enlarged the elements of service and brought new dimensions into it. And we hope, of course, that this will have a positive impact in the future also, that this kind of elements, which can really benefit many people and also in different kind of situations, that these remain as a part of service also when we go back to, let's say, new normal way of living. And the next one, please. I think it was already the concluding remarks. Yes. And so overall, this goes to a COVID-19 situation, and of course, in every situation with supported decision making, it's fundamental to think individually how each person can have maximal autonomy, choice, and control over their lives. It's self-evident that it means different things for everybody. Everybody needs support to do that, different kind of support. It has to be created also always the support person by person, and this situation and every situation always. This becomes reality in everyday life, and small choices made in it, and bigger decisions about how a person wants to live his or her life. So always I think we have to kind of, not always, but I think it's quite often useful to separate a little bit these different dimensions of supported decision making. That person always has to have a right to make choices in their everyday life, and how service provider can support those. And then in these bigger decisions, which of course are also, for example, that who provides the service for the person, like said by Simon and some other speakers, self-directed support and so on. So this is more structural way and structural support for the people. However, also often this support is also offered by staff in the services, but this has to be thought through, let's say, how this is made. Also, I think Sophia, you mentioned that it's important to practice decision making so that we don't give up. Let's say if person is not able to do choices, for example, in the first place, we have to give everybody a chance, a lot of chances, and a lot of room to practice and to support for practicing also. And so service providers have to create these opportunities. Sorry. We have to say that in everyday life, the role of service provider in supported decision making of person with disability is quite big. Sorry, especially of course with people with very high support needs. So staff needs to do a lot to work to find out what kind of support each person needs to be able to make these choices, and all this requires competence, a lot of communication and respect. And I think it's quite the most fundamental aspect that everyone has to be seen as active decision maker. And when staff, when staff is able to do that, to see everybody in respectful way as a decision maker, it's already a long way. And this is the starting point. And all this has to be there in place so that we can face all those challenges created by these situations, and of course in many others. So I think that was what I wanted to say. We can of course have a discussion afterwards. Thank you.
Thank you, Kirsi, very much also for your intervention. Many important points also were highlighted during your presentation. I would like to just mention two of them. And one of the first is the focus on individual needs, the focus on the persons themselves, and also something that was highlighted both by you and Sophia, to actually listening to what the person wants and needs. And with this in mind, I would like now to pass the floor to Mr. Pat Clark from the European Disability Forum. So Mr. Clark, as a representative of EDF, representing the interest of persons with disabilities, what else needs to be done to ensure that persons with disabilities access their right to legal capacity? Mr.
Yes.
Clark, the floor is yours.
Good afternoon. Thank you, Konstantina. And following the protocol, good afternoon, everybody. I wear glasses. I have an abundance of grey hair. That's testament to my age and to 40 years of advocating for people with disabilities since the birth of my son, David, who has Down syndrome. I wish to thank EASPD for organising this event and involving the European Disability Forum. And as you mentioned, EDF is an umbrella organisation that represents more than 100 million European citizens with disabilities. So the first recommendation that we always have in relation to any law or policy impacting persons with disabilities is to actually involve persons with disabilities themselves. It may sound simple, but the first thing to ensure persons with disabilities have access to their right to legal capacity is to work with organisations of persons with disabilities and self-advocates. All actors need to understand the issues and the problems with the current guardianship and curatorship, and what is needed is proper supported decision-making process. Nothing about the people with disabilities without people with disabilities is a basic principle, but it is very hard to achieve this. The second point is that states need to understand that this other system is possible. When we talk about the UN Convention on the Rights of Persons with Disabilities and support to decision making, many governments do not believe it is possible. They think it is an unrealistic goal and thus are not putting any efforts to change the system that is there. This is why it is so important to explain the system, to explain that this system, this new system, is possible, and what better inclusion and ensuring the rights of all will only create a better society. They need to move away from the charity-based approach and paternalistic society, and we are talking about people's fundamental rights here. The issue is that there is a lot of reforms currently taking place, and because they are not ambitious enough and do not align with the CRPD, they actually don't respect the rights of persons with disabilities. In 2017, the UN Special Rapporteur on the Rights of Persons with Disabilities published a report where she analysed 32 law reforms and explained that most of them were not compliant with Article 12 of the CRPD. Some are close, but not close enough to comply. Systems of guardianship continue to exist alongside supported decision-making systems. And so the third recommendation is to look at how some countries have moved actually away from guardianship. Peru is probably the most compliant with Article 12 in their supported decision-making system and is recognized by many UN agencies. Colombia did very similar reform in 2019, but there are some gaps. These are two best practices. I know that in Ireland we've passed the Decision Making Act some years ago, but it hasn't been fully enacted and enabled, and the supported decision making service that was supposed to be put in place is still, we are still waiting for that, and we still work towards it. We still campaign very strongly for it. Now, as I said, I'm not an expert on these systems, but we really encourage you to look at them. South American countries have been more successful in advancing the right of legal capacity that we have at a national level. There are some good examples in European countries, but at a more local and regional level, and these may well be addressed by my colleague Pep Sole afterwards. We must ensure that they are given the visibility and spread at a broader scale. So thank you very much for listening.
Thank you very much, Mr. Clark, also for your contribution and for highlighting all these different elements. Most importantly, I will just mention to highlight, if you allow me, the nothing about us without us principle. And also based on this, I would like to inform our participants about the work that ESPD together with EDF have done together with other also organizations on co-production. For those that are not familiar with co-production, is an inclusive working practice between expert by experience, meaning persons with care and support needs, organizations being of support, and public authorities, and also other relevant stakeholders. And this has the aim to develop a policy, for example, that will be responsive to the individual needs and preferences. So thank you, Mr. Clark, for highlighting it and for allowing me also to highlight this important work that has been done in cooperation with our organizations. And now, as already mentioned, I would like to pass the floor to Pep Sole from Support Girona in Catalonia, in Spain, to tell us what are the next steps.
Thank you very much, Constantina, and all the present speakers. It's not easy to talk about next steps, but there are a lot of next steps that we must do if we want to achieve that minimum goal, is to recognize everybody a human right that is explicitly written in the treaties, and that the states has adopted universally there are around 20 countries in the world that has made some kind of reservation in the implementation of Article 12, but the majority of them has adopted Article 12 of the UNCRPD as their the human rights framework where we have to work. Can I share the screen? I suppose yes.
Yes, please.
Yes, perfect. Well, just to organize my ideas, because if not, I can start talking and never stop. First thing we have to do, absolutely generate a general social awareness on this recognition of legal capacity. It's not only a matter of reforming legal frameworks. If then, after legal frameworks change, the person is not recognized in a bank office, in the notary, when they go to the dentist and ask for a budget about one intervention in their mouth, because someone feels that that person will understand all the terms of the agreement that they want to do, then the legal framework will not meet this human rights approach that is needed. That means we have to work in the general awareness about this right to take decisions, the right to make choices, and that these choices can be not shared by the families or even by the supporters in the professional services. We have to assume that. Without assuming that, every legal reform will fall short. And then, worst thing, the environment, will be a barrier to facilitate human rights. When we as a supporter, we don't recognize the person in this ability to take decisions, we are in a position of barrier for the human rights, and we have to assume that. Of course, legal changes will boost this transformation. I'm very happy that now in Spain, our parliament passed a draft law last week with a full implementation of Article 12 of UNCRPD. At the end of the session, we discovered that the paper approved by the parliament now has to pass the Senate and can be amended, but we hope not in the main issues. We discovered that there has been one improvement of this draft law from the paper that was introduced in the parliament. Now we are talking about will not be neither incapacitation in no proceed. Nobody will suffer one limitation of their legal capacity. It's not a change of terminology, it's a real transformation. Then the law recognizes the need of all kind of reasonable accommodation in the practice of this legal capacity everywhere, makes a specific approach in the notaries and where the legal actions are made, but it's a call to the whole society. And then recognize informal supports that could be very easily recognized with a paper, I mean, from the court, if you need it for some legal action, or then when you need more intensive support for some kind of issues, you can ask for a defender on that issues, heritage, some economical thing that is not normal in your life, is something extraordinary. And just if you need support provided for a period of time that is not concrete and for more than one issue, you can, or can be provided a kind of curatorship, I don't like the name, but without representative powers, with exception when the person cannot express their will or the court cannot perceive that will. It means in exceptional cases where the disability is severe and there is a lot of barriers if you don't have representative powers to do that job. But then when you exercise these powers, you have to follow the best interpretation of will and preferences. That means we are online with general comment number 1 of the committee of rights of persons with disabilities, and it will suppose a huge challenge for all the system, the legal, but not the legal one, just the legal system, also the providers of service like us. With these new reforms, there is a legal reform coming in Germany. In Germany, they don't have official incapacitation, but they have a system that can provide your supporter with the same range of powers than a guardianship. And in my opinion, the legal transformations that we have, for example, the Portuguese one, the Austrian one from the same year, are limited in the practice, in the life of persons, because, in my opinion, there are still one vision of someone must support and decide on behalf. And this is generally standard. And when that happens, it's not enough with a legal transformation. But in my opinion, when this new legislation will come up, there will appear the need of new types of supported decision-making mechanisms. Recognition of informal supported decision-making, the friends, the family that are doing that job, that in one specific case could be in need of one paper to overcome a barrier, an administrative barrier for some legal action concrete that you want to do. If the person decides, I want to be supported by that person, and there is no opposition, that must be very easily, not under bureaucratic and judicial procedures.
Dear Pep, I'm sorry, I apologize, but you have 1 more minute.
Okay. What we have to talk about is needed a debate on risk management, because legal capacity means the right to decide, means the right to take bad decisions and make mistakes. And what cannot happen is someone must be responsible of these mistakes when you don't have the power to decide on behalf, or you cannot stop one decision when you see that this decision will produce harm. This is something is basic for the service providers, because if not, then we will feel the responsible of the situation of the person more than the legal framework and now the human rights basis means for us. Some people needs intense support decision-making and social supports. For example, persons coming from the institutionalizations, or when we want to prevent institutionalization of some kind of people that need a lot of support to overcome the virus and the conflicts. And in my opinion, we have to build up social support decision makings that are the bridge between the person and the services, the person and the conflicts around their behavior, their performance in the community. Because if we don't work on that conflicts, then the society will not understand what legal capacity means for everybody. And this is my view for the next steps. I hope that it will be useful for you.
Thank you very much. Very important points as well. And because I see that the time is passing, there is one more element that I would like to ask Mr. Clark to address. And this is what has already been mentioned a couple of times, the draft additional Oviedo Protocol. Mr. Clark, would you like to tell us more about that and why we are advocating against it? Thank you.
Yes, my screen moved around and I was hitting the wrong buttons. So yes, thank you very much for allowing me back in again and to speak on this important topic. And it's something that we are working with in EDF along with Mental Health Europe and the ASPD. And we've campaigned long and worked very hard against this for quite some time. We will never be able to ensure the right to legal capacity when at the same time mental health legislations and reforms continue to promote involuntary treatment and placement within psychiatry. These laws are ignoring the right to choose and control of the persons over their own life and treatment. Supporters of such laws often talk about the last resort, protection of persons, safeguards, and imminent danger. While they are the only resort, and mental health systems have failed time and time again the people who need this support. At a recent Parliamentary Assembly review of the Oviedo Convention, the protocol, and they are against this particular protocol, the chair of the DH Bio stated that only legal change will change the treatment culture, and that is the additional protocol. I agree that if only a legal instrument would change the treatment culture, then it should be one that prohibits coercion and align with the CRPD. As you know, we are opposing this draft additional protocol developed by the Council of Europe and their DH Bio committee. We have opposed it for many, many years, and still it may well be adopted in June by the Committee of Bioethics of the Council of Europe. The timetable for this is that on June, the DH Bio Committee will probably adopt it. And then in June, between June and September, it will be put to the Steering Committee of the Human Rights, which is a formality and it's a non-binding opinion of the Parliamentary Assembly. In the autumn, it will go to the Committee of Ministers, and that may well be, we don't know, but that's when it will be. So what we're doing now is we are launching a stronger campaign against the adoption with the launch of an advocacy toolkit and an event which we are doing with Mental Health Europe tomorrow afternoon at 3 p.m. Central European Time. We invite you to join, and you can find more about this particular information on our website and in the chat box. So I would like to sort of invite you all to come along to this. It will be a very high profile campaign. We will be using all the international actors at every level, the Secretary General of the Council of Europe, the UN High Commissioner of Human Rights. We will have WHO involved with International Disability Alliance, and we will also have the European Commission, etc., involved at different levels for this campaign. It's a very high profile campaign. So thank you very much, and I look forward to as many of you as possible joining us tomorrow afternoon. Thank you.
Thank you, Mr. Clark. And now I would like to ask Pep Sole if he would like to briefly also make a remark. Thank you. We cannot hear you. I'm sorry. Can you please unmute yourself?
Yeah.
Thank you.
Of course, the Oviedo Convention or the draft additional protocol puts in paper something that that is a real challenge for human rights. Human rights always has been a fight between the right of the people and the power. Now the power is in the hands of some professionals and public service that can decide that someone must be put in a hospital or treated without their consent. Of course, the crisis situations that the Oviedo Protocol wants to arrange in their medical view are very challenging for everybody, also for service providers like us. But the alternative, if they win, if they achieve the goal to convert in a binding treaty this protocol, organizing and regulating something that is forbidden for the UN CRPD and the interpretation that has made by the European United Nations, then the status quo will be maintained, and the people with intellectual disabilities, psychosocial disabilities, will always be under this power that is put in hands of single persons that have to decide if someone is treated or not against their will. Of course, there is a lot of knowledge on how to handle these conflicts around some behavior. I mean, when there are no criminal actions, that means people that feels in a mental health issue and is perceived by others. And how to handle that with another approach is acknowledge that we have, as providers, to try to contribute because there is a gap that we have to fulfill. There is a lack of organization of the resources we have on working in another way, more preventive, more trying to perceive this will of the person and try to convince the person that there will be a different way of living if the person is treated, but not with coercion, with another way of caring. And this is what is needed. And the system doesn't want to do it, is that the reason they prefer to regulate how the powers of these professionals will be used. And it's not to improve, is, I think, in my opinion, it will fossilize the mental health systems around Europe and will be a breakdown on the united vision of human rights. This is why I propose ESPD to contribute to this campaign against the draft additional protocol of the convention and be active in trying to change the system to respect the human rights of everybody.
Thank you, Pep, very much. And you can find the link on the chat box in order to register for this very important event tomorrow. I would like, I see that we have a few minutes, and before I pass to Luke Zelderov for the closing remarks, I would like to address one question that is remaining in the Q&A box. And so they ask, how are the speakers working with their authorities to change mindset and law? Do you receive funding to support this transition, training of staff, training of users, or other? Who would like to take the lead and respond? I see that Peppa wants to take the lead, please.
Not easy to handle that, but we have one tool, and ESPD has provided a tool, is a Lighthouse network. For example, what we did with Margarita 2 years ago, helping them to introduce the idea of this recognition of the right to take decisions between the users and between users and family and some staff that doesn't agree absolutely with the idea at the beginning. This is something that we can use. We have inside the members of ESPD more advanced and trained in that field, and sharing knowledge is what we have to do. There is not enough knowledge around the world to overcome all the barriers. But Clark mentioned the legislation on Colombia. We are supporting the NGOs of Colombia to try to be trained to use the legal reform, because it's not easy, it's not evident. But inside the ESPD, there is a lot of talent that can be used to fix that. And we have two positions: or we are facilitators of these human rights, or we, as service providers, will be seen as a barrier for them.
Thank you very much, Pep, for this very strong message at the end of this webinar. And as I see that the time has already passed, I would like from my side to thank all of you, first of all, the panelists, for their great interventions and for highlighting all these important topics, points and messages, and also for the participants that have been with us for 1 hour and a half now. And thank you very much also for your questions. I saw that some questions have already been responded by some of the panelists, so thank you very much for that as well. And now I would like to pass the floor to Luke Zelderov for the closing remarks. Thank you again.
Thank you very much, Constantina, and on behalf of ESPD, I also would like to thank you. You did an excellent job. Moderating such a webinar is not so easy, and you did very, very well. And as you already said, I also would like to thank the speakers. I also would like to thank the speakers for putting so many interesting links in the chat box. Indeed, we have the campaign that is organized by EDF there in the chat box, but there are 2 or 3 other very interesting links, I think, on the unique project and on other activities. So important for those that are interested in knowing more about all these projects and activities. Copy paste the links before we have to close so that you have all this information. That the topic is an important one that was made, I think, very clear by the different speakers. And we as an organization, as a network of service providers, we are working on the implementation of the convention since it became effective. And I must say, in the first years, we mainly focused on what was linked to direct service provision. Deinstitutionalization, more inclusive education, inclusive labor markets, access to cultural participation, and so and so. And in a way, we maybe forgot a little bit to look at the broader picture. And what we discussed today, I think, is indeed about this broader picture, because we see that legal capacity is an essential building block, and disempowering practices can have such a negative effect on people, on their well-being, on their inclusion in society, that we as service providers also should play a role here, I think, and support the efforts of persons with disabilities, their families, their DPOs, to tackle also this issue. And it became clear during this corona crisis that in times of crisis, the situation is even worse. And then it becomes even clearer that quite often shielding and protecting is used sometimes as an excuse, sometimes with the best possible intention. It is used for taking away self-determination and choice of people. And we should, I think, build on this experience and make sure that we make progress. Because as I said at the outset of this webinar, and it was confirmed by almost all speakers, most European countries still have a lot of work to do to make sure that persons with disabilities can enjoy the same rights as their peers. And indeed, we have to move from a stripping away attitude towards what is needed, what type of conditions should we create so that people can enjoy their legal rights. We as ESPD should, and will, as I said already, bring this topic also to the European Union level, also to the Council of Europe, of course, and work with other organizations to keep this on the agenda. And then the first element of cooperation with other organizations is indeed, as explained by Pat Clark, and thank you again, Pat, for being with us, is about this draft protocol. The draft protocol is based on the wrong assumptions. It is based on an old understanding or not understanding of disability, and that has to be stopped. We need new legal frameworks. We need laws and juridical approaches that are based on a human rights agenda, the human rights agenda of the UN Convention. Providers quite often are indeed a bit sandwiched, yes, in between the wishes and the desires of the people they support and what is legally allowed or what is the legal responsibility of people. And that is not a very comfortable position, but still there are possibilities there. And it was made very clear, I think, by some of the speakers. We should not always immediately aim at a sort of a, I don't know what, fantastic legal capacity. Most choices we make are very small, day in, day out choices of our day in, day out life. And we should, as service providers, start by developing an empowering culture in our organization. An empowering culture which is based on correct information. Correct information, informing service users, families, in a correct way is the starting point. And quite often that has to be done by providing easy to read. Developing a culture of empowerment, I think, is absolutely essential. A second action that we as service providers should implement, should undertake, is providing examples on where we see this clash between the wishes, the plans, the desires of people, and the legal responsibilities that we as providers might have. We have to register these clashes so that we can use them in our advocacy work that we should do together with persons with disabilities, with the DPOs. We have to do that together, because indeed the starting point should be close cooperation, co-production, and we indeed also embrace the adagio of EDF, nothing about persons with disabilities without persons with a disability. Maybe last element for the individual service providers themselves, let's stretch the legal frameworks to their maximum. Within the existing legal frameworks, we can do already a lot. So let's stretch that as much as possible, and indeed start developing knowledge, practices, know-how on supported decision-making and supported decision-making support. By understanding these mechanisms, we already can do a lot, I think. What will ESPD do? As the umbrella of the support services, we will work with EDF and other DPOs, and that is self-evident, I think, on this topic. We will bring this topic to the Disability High-Level Group and the new disability platform, which is launched 2 weeks ago at the start of the new disability rights strategy. We will organize exchange and learning. Indeed, PEP, board member of ESPD, referred to the Lighthouse initiative of ESPD. We also have many projects that look into legal capacity and how we can further develop our thinking, our practices, the quality of our services in that area. So exchange and learning is very high on our agenda, and we will work on that. And of course, we will also make this topic, legal capacity, choice and control of service users and persons with support needs, an essential part of the new ESPD strategy. In May of this year, during the General Assembly, which we would have organized in Lisbon if this corona pandemic would not have stopped us, but we will do it online. During that General Assembly, we will discuss the new multi-annual strategy of ESPD, the strategy for the coming 3-4 years of this organization, and legal capacity will be an essential part of that. We will put it in our strategic objectives, and by doing that, we hope to contribute to a society where all persons with support needs can enjoy their legal rights, and by doing that can stay or become respected citizens. Again, thank you very much, Konstantina, for organizing this very interesting webinar, and I wish everybody all the best for the rest of the day. Bye-bye.